I love anatomy. I think it's a great field to love and to want to teach because most people are fascinated about their own body. Even people that their first reaction is, ooh, I don't want to know anything about my heart, but they really do. My first deployment was the earthquake in Haiti, which was one of the biggest disasters in history. And that was incredibly intense. Just because it's a really big problem doesn't mean I can't go and do something. We're not here to just be comfortable all the time. So, if you keep your eyes open and you find something that piques your interest as well, maybe I could do that, then give it a try.
Hi everyone, my name is Irene and welcome to Oceanside Perspective's new series, Purpose, Why Medicine, where I speak to professionals in healthcare who exemplify living with purpose and want to share their unique journeys, experiences, and learnings with our audience. I'm here today with Dr. Gross, a distinguished anatomy professor, practicing pediatrician, and medical director of UC Davis School of Medicine's student-run pediatric clinic, River. As a humanitarian, he has led medical teams to provide care in remote regions of Africa, Central, and South America, and has collaborated with the World Health Organization to reduce infant and child mortality. As a former student and lab aide of yours, who has learned from you, I'm honored to be interviewing you today, Dr. Gross. Thank you for being here.
Yeah, happy to be here.
Yay. So I want to take us back to the beginning of your journey to medicine. After interviewing a couple physicians for this podcast, I've come across two schools of thought. Either you're born out of the womb knowing that you want to be a doctor, or you kind of discover that interest along the way. Did you ever consider another career, or was being a doctor always your only choice?
I know I not only considered one, I had one. So medicine was not something I really had thought about at all. When I was in college, I was a biology major. I liked biomedical sciences, but I had no real focus and no real plan. I had done some teaching because I was an education minor. I had done a little bit of research. And I'd taken a couple of anatomy courses at my college that I really liked. And I was sitting with the anatomy professor saying, I have no idea what I want to do when I graduate. And he said, well, you like teaching, you like research, you like anatomy, maybe you should consider graduate school. And so I did. And I ended up going off to a wonderful program at the University of Michigan. I was trained broadly in all aspects of anatomy, was in a very rigorous research program, and became a professor of anatomy, first at Temple Medical School and then here at UC Davis. And I was very happy doing that. And that went on for almost 10 years. And along that path, I decided I wanted to start doing some work in the community. And I ultimately found this program that is a kind of socialization recreation program for developmentally disabled kids. And I started volunteering in it, and I started spending more time in it and more, and I just fell in love with this program, and I fell in love with the kids and was really becoming almost another full-time job. And at some point, I realized that that wasn't really very sustainable. And I kind of had to make a choice. Do I want to shift my career where I'm working really more directly with kids, or I need to give up that program and get back focusing on my real paid job? And so over a couple of years, I made that decision to go quit my tenured faculty position and go to medical school with the goal of becoming a pediatrician. So this is quite a bit longer road than a lot of people.
Yeah, that's amazing. So what drew you to kids or pediatrics specifically?
I mean, I've always loved kids. I love working with kids. I love the spontaneity. They're usually very happy. Even sick kids, sometimes you can work with them and it can be a joyful thing. So, and I like the challenge of, as a physician, figuring out how you can get the information you need to get, how you can do an exam. It's more like playing than it is, just doing a regular exam. So, yeah, I just love everything about pediatrics. And I love the parents, too. A lot of people think, oh, that's the downside, and you have to deal with the parent. But the parents are there because they want their kids to get better. And so it's a great opportunity to educate parents about how to keep their kids healthy.
Yeah, that's amazing to hear, especially the communication aspect, I think. How is communicating with parents different than communicating with your children?
Well, you have to do both. I mean, depends on the age, obviously, like everything in pediatrics, but I always try to talk to the kids. And then you can talk to the parents. But, I think the key thing is that it's a collaboration. You and the parent want the same thing. They want, if the child is healthy and they're just there for routine things, they want to know what's coming up and how can I keep my child healthy. If they're ill or injured, they want to know how can we make this better. Same thing you want. So making that clear that we're both working toward the same goal, I think is really important. But not ignoring the child. You can talk to the kid. And the kids, once they get past 2 or 3, they kind of want to know what's going on. They're very curious. And so you have to be able to put that in terms that they can understand. So as a teacher, I find that a fun challenge.
So how has the field of pediatrics changed since you began practicing in it?
Well, I think like everything else in medicine, things have gotten more complex. Things have gotten more technologically advanced. But I find that managed care has changed things. But when you're in the room with the patient, I don't find much has changed. I find that what you do there one-on-one with the patient is kind of the same thing that you always did. There's differences. Like when I started in pediatrics, it was like, you do everything. You see patients for well child visits. You see sick kids. If kids get admitted to the hospital, you take care of them in the hospital. Pediatrics, like most specialties now, medical specialties, has hospitalists. So there are specialists that when you admit that patient to the hospital, they take care of them, which is probably a good thing because then they're doing that all the time. So many of us that used to do all of that have more shifted to more outpatient care. But yeah, it's not dramatically different. The core of what you do. You make a relationship with that patient, you try and take a good history and do a good physical and figure out what's wrong and develop a plan and communicate with the parent what that plan is going to be, and you follow up to see if your plan is working. The core has not really changed.
So with the rise of AI and other technologies, do you think that core will change over time? Or do you think it'll stay the same?
I think one change that, I didn't mention that relates to that is the patients, I think in medicine in general, have become much more informed. So a parent will often come in and say, well, I think I know what's going on here and I know what we should do because, I Googled it and I read about it. To me, that's a good thing because there's often misinformation, but it's an opportunity to have a discussion. And clearly they're interested. So, and I've had patients that sometimes have put me on to information that I wasn't aware of. They'll say, I read about this. And I say, I really never heard of it. I'm going to find out about it. And more often than not, it's not really useful, but sometimes you find something that really is. So I think that level of engagement by the patients in their own care is always a good thing. The problem is there's so much information out there is getting through the morass of not so good information to find the good information. That's the real challenge. And I think that's going to be true even with AI.
So definitely something new for physicians to manage.
But that is where a good relationship between you and your patient is critical, because then you can have a conversation. It's not some adversarial thing where they're coming and saying, well, I read this, and what about this? And you going, no, that's stupid. It's, oh, well, let's talk about it. So, I think it's always a good thing.
So I'm not sure how long these appointments that you have with your patients are, but usually it's like an annual exam or something like that. How do you build rapport during that short amount of time?
That is an important skill, and that's gotten harder because times with patients have gotten shorter and shorter. I think the critical thing is you have to make them believe that you really do care about what's going on with them. So that includes, even before the visit, if you're running late, stopping by the room and saying, I know I'm running late. I'm really sorry. I haven't forgotten about you. I will be there as soon as I can. And then you get in the room and you introduce yourself and you ask them to tell you what's going on, and then you shut up for a while. You stop and listen, and you really listen. And you don't listen while you're looking at your watch or looking at your computer. You actually listen. And then you go through what you're going to do, and at the end you ask them, are you comfortable with this? Does this seem good? And you give them a plan, and you give them an option of, what if this plan doesn't work? Here's what we're going to do. If your child isn't getting better, then I would want you to call me, and this is probably what we would do next. So they have an idea that you have a plan. And that's what most people want. They want to know, number one, you care about them and you've got a plan. They're not just kind of going off with, just some hope.
Mm-hmm. So talking about teaching, what first drew you to teaching, and anatomy in particular?
Well, when I was in college, I took an education course, and as part of that, you had to go in and do some student teaching, which kind of scared me. But when I did it, I actually found that I really liked it, and I found that I was good at it. I wasn't as nervous as I thought I would be. I was able to work in that setting, and I found that I really loved getting an idea across that students were struggling with and having them say, oh, I kind of get that. And so I've always loved that. Anatomy, I love anatomy. And I think it's a great field to love and to want to teach, because most people are fascinated about their own body. Even people that their first reaction is, ooh, I don't want to know anything about my heart, but they really do. And so when you can really explain things to people and put it in the context of, this is how your body works, and then also this is what happens when things go wrong. Most people are really fascinated by that. So my teaching career has been one that the students in general really love what they're studying. It's not easy, it's a hard subject to study, but students in general like it. And so if you like teaching it and they like learning it, it's like the best of both possible worlds. So it's a very, very fun topic to teach.
I definitely agree. As a lab aide and returning lab aide, I love teaching, especially anatomy. It's just the hands-on aspect, especially in lab. Oh my goodness.
Yeah, and I think you have the opportunity to work with all levels. I find it every bit as rewarding to work with a superstar student, the one who really knows their stuff and is going to push you beyond and wants to go beyond, or the student that's really struggling and barely getting by. You can help both of them, and so that's very rewarding.
Yeah, it definitely teaches a lot about communication as well, and how to relay that information in different ways.
Yeah.
So you've taught generations of healthcare professionals, from undergrads to medical students to residents. What qualities stand out in your most memorable students?
That's a great question. One of the things that I love finding out about students is what they're passionate about. So that quality of being passionate, it doesn't necessarily have to be they're passionate about the subject that you're talking about, but they may be passionate about getting to a point where they can help people, or they're passionate about some aspect that you're learning about, or they may have a passion for particular types of illness that's maybe occurred in their family. I love seeing that. I think most of us in medical education really appreciate when students understand that this is a process, and there's steps in a process, and you really need to be able to appreciate, okay, I have to walk before I run. I need to understand, say, this basic anatomy, and then once I understand that anatomy, I can then add the physiology into it and the biochemistry, and you get this broad picture of how the body really works and then what goes wrong. And I think some students get that sooner than others. And when they do get that, it makes that whole learning process really exciting. It doesn't make it easy. And certainly in medical school, it's not easy at all. It's a ton of stuff and really hard work. But you can then approach it with that sort of sense of joy that, wow, this is really kind of like a privilege to be under this stress and have to learn all this stuff, because look what I'm getting to learn and look what I'm going to be able to do with it. So I think students that come to that realization, those are the ones that are kind of special. A lot of students get there, but it's at various stages in their career.
So what's something that your students have taught you?
Oh man, lots of things. Number one, that I don't know everything. I mean, students always will ask questions that, you can think you're an expert and you know everything there is to know when you're talking about a subject. And then a student will just ask one simple little question. You go, oh, never really thought about that. That is a great question. And, usually my response is, how about this? I'm going to do some reading and you do some reading and let's get together again and talk about it. And then everybody learns. That happens a lot. So yeah, they've taught me that. They've taught me, I think my students have taught me better communication skills. I tend to be on the sarcastic side with my humor, and sometimes it doesn't go over as well as it should. And so I've learned, that not everybody is the same, and some people need a bit of a different approach, and some people like that. And so, I think I've gotten a little bit more flexible in how I deal with students, and how to be supportive, realizing that, everybody learns differently. I think that's something that I kind of knew at an intellectual level, but not really at sort of a gut level, until you realize there are students that are just struggling, not because they're not smart enough, that they're trying to learn it in a way that's not suited to them. And so that's always a fun challenge too. Is, okay, how can we work together so you can figure out what way works for you? And I'm sure you've seen that with your students. They're all different. And, getting them to that point where all of a sudden there is, oh, this is what makes sense to me. That's always a lot of fun.
Mm-hmm. Whenever people ask me, like, why do you like teaching? It's like, I love seeing that light bulb moment of when it finally clicks, and then they're like, oh, it makes so much sense. Yeah, I definitely agree with your passion for teaching. Has your approach to teaching changed over the years? What's something you understand about teaching now versus that you didn't when you first started?
I probably am less focused on small detail than I used to be. I think that's often true with educators in general. When you're younger, you think you need to go into great depth and great detail, partly because you think you need to show everybody how smart you are. And so you can get into all this amazing detail. And as you mature a little bit, you realize, okay, I don't need to show people how smart I am. I need to figure out what's really important for them to learn, and maybe come to grips with the fact that, gee, this topic that I find so fascinating, they don't really need to know that. And you have to gear that toward what they're doing. If you're teaching medical students, you can say, well, okay, do most medical students really need to know this? And so I think I've evolved to really think about that. And, what is it that's really important that I want them to take away? And then to try and teach it in a way that they will retain it. I mean, that's one of the kind of the core values that I have. I don't want people to just leave my class and then come back a year later and don't remember anything. Then we've all wasted our time. So putting it in a context that can make some sense to them in the real world, I think is always useful. Mm-hmm. But yeah, I think I've modified my approach somewhat.
Yeah, I definitely agree. Like the first time I taught, so much detail, and I saw that the students were getting overwhelmed, and though that is information they need to know eventually, I learned that actually simplifying and making things distill down to their most basic concepts is a good way to go. When I was doing research for this interview, I was amazed to see that you started teaching anatomy about 30 years ago. Is that right?
I started, let's see, I first taught anatomy in 1978. So that would be what, 22 and 25, 47? Yeah, almost 50 years now. Yeah.
At Davis, about 30, and then
Yeah.
previous to
I was
that,
at
even
Temple
more.
before that, so yeah.
Yeah.
Long time.
I can only imagine the impact that you've made on the thousands of students who have taken your class. But before we move on to discussing your global travels, I wanted to surprise you with a message from one of your former students, Dr. Luis Castellanos, who is now a cardiologist, professor, and director of a medical program at UC San Diego. His message is, I took the course with you as a senior at UC Davis, class of 1998, and it was certainly challenging and rigorous, but you made the class fun and entertaining. I learned a great deal of human anatomy, and the material helped me understand the functionality of the human system. So when I encountered the subject in medical school, much of the material was a review of what you taught me. This led me to become a successful medical student and someone who my peers could come to with questions. Dr. Gross's human anatomy course definitely improved my self-esteem during my preclinical years and was instrumental to my success at Harvard Medical School, class of 2003.
Ah, that's awesome. Yeah.
How do you feel about thinking about all of the students who you've taught over the years and what they've gone on to achieve after?
Oh, I think it's wonderful. And when you hear things like that, I just had a student contact me he's a retinal surgeon. A similar kind of thing happened. He just said, Dr. Gross, and I was walking through the hospital, and he said kind of a similar thing. It really inspired me. And sometimes you wonder, what your impact is, but then you realize, yeah, you do have an impact, and I think, yeah, it's very rewarding. So it's nice to be able to do something that you really love doing and realize that it does make an impact in people's lives. So, it's teaching and patient care together. It's very similar. You've impacted people's lives.
So speaking on global health and your humanitarian service, during your lectures, you're known for sharing stories from your global travels and medical missions. How did you first get involved in humanitarian aid?
I met a man from West Africa. Turned out he was here trying to raise money because he was actually a church pastor, and he was trying to set up some medical clinics among all the consortium of churches in the area that he was, because the medical care was almost non-existent. And we started talking, and he said to me, well, how would you like to come back to Africa with me and see what conditions are really like, and maybe if you would be able to help out? And he was a very dynamic, persuasive guy, and I said yes, which was totally out of character for me. I remember going home and said to my wife, I think I'm going to go to Africa. And she said, what? You don't even like camping. And but I did that, and I went with him, and I saw this whole other world. I mean, so different than anything I'd ever experienced. And again, fell in love with that. And that's what got me started. And so I worked with his organization for a little while, and then it sort of expanded and started doing a fair number of projects in Africa, and then got involved with the World Health Organization because I was seeing, you see the same thing over and over again. It's driven by poverty and lack of access to care, and realized, wow, there's maybe something more we could do. And so I started contacting the WHO about this new program they had, which was really geared toward training village health workers how to identify and treat the big killers of kids, which are very mostly treatable conditions, but oftentimes the people providing the care don't have any training. In remote areas of the world, you don't see a doctor, you usually don't even see a nurse, you see a community health worker. And I thought, well, this is a fantastic program. And so I got involved in doing that for quite a few years. There was just something really powerful about being in a place where small interventions can have big effects. And so I really liked that. And I found I loved getting to know people and talking to people whose lives are so different than your own. It was just an amazing experience. So I went on and just continued with that. So I've always loved global health, but there's a lot of problems with doing sort of medical mission kind of global health where it's often not very sustainable. And that's one of the reasons that drove me toward to work with WHO, to try and have something that's a bit more sustainable.
What do you consider to be the most challenging part of the work that you do there?
I think one of the big challenges, and it's something that I always tell people who are going to come with me, is realizing that you can only do your best, and you can only do what you can do. You can't always really truly understand the local culture very well. So, we may try, but I always remember a friend of mine who works in China, in a very remote area of China. He's been there about 15 years. And I said, so how long did it take you to really understand the local culture? And he said, well, I've been there 15 years. I'm starting to understand a little bit of it now. And so if you're going in, for a short-term project, you have to somehow convince people that you are there to help them, but you only can offer them what you have to offer. I can offer Western medicine. That's what I have. That's what I'm good at. And you have to convince them that you're really there to help, and you're gonna try and do the very best you can. And that's sometimes is a challenge. And with the limited resources that you have, sometimes the best that you can do isn't very good. And so that there's going to be, problems that you're not really able to address. And that can be very frustrating. And so I've had a number of colleagues who've just said, I can't do this anymore, because if I had that person back in my hospital, back in, New York, they'd be fine. But here, there's nothing we can do. This person's going to die. And that's very discouraging. So you have to kind of keep that attitude. I can do something, and something is better than nothing. And if you really want to solve the big problems, then doing it one-on-one with patients is probably not the way to do it. That's what I love to do. But that's one of the reasons I got involved with WHO. Okay, there's programs you can do, or work in, global monetary policy and trying to address poverty, or, those are where giant changes happen. But not all of us are equipped for that, and I'm certainly not. But I'm very good about one-on-one interaction, so you do what you can do. And you have to, at some level, be okay with that I'm not going to solve every problem. But just because it's a really big problem doesn't mean I can't go and do something, because you impacted that person.
So I'm sure you get this question a lot. Systemic issues like fragmented care or social determinants of health or lack of resources can feel really overwhelming to try to fix as an individual. What can students or those who want to make a difference do to help out?
Yeah. I think the number one thing you can do is educate yourself about what those issues are, because it is a big problem. But as you get more educated about those problems, you realize that there are a lot of things happening that can address small parts of those big problems. You're not going to solve, the inequality of healthcare delivery in the world probably in your lifetime, right? And not as a medical student or an undergrad student. But there are things that you can do. So you identify people that are doing things that seem to be making a difference, that are doing it well, that are well thought out, and you can get involved in those. You reach out, you look for opportunities, and you say, I'm going to do that. And then sometimes, in a rare case, that'll lead to a change in your career trajectory. You may decide, I want to go into public health and global health, and at the policy level, which may mean, getting involved in government programs. You may say, no, that's not like me. That's not where my strength is, and you go in a different direction. But there's always things that you can do, but you have to become educated. I mean, for people that really are interested in that, I would say seriously consider getting a MPH degree, a Master's in Public Health, because there's so many ways to approach problems and so many ways to think about them that, just like everything else, you need advice and information from people that are experts, and that can give you that. And it also gives you a bit of a foot in the door if you decide I want to go work in a program and be of some help. You've got the credentials to do that. Becoming a physician is a good way to do that as well. It gets your foot in the door as well. But a lot of the issues are ones that are kind of skimmed over a lot in your medical training. So I think that's something that you can do. And I've learned a lot, but I've learned a lot by making a lot of mistakes rather than that maybe could have been avoided had I had appropriate training when I first started out. So yeah, I think that's it. And then being passionate about it and recognizing that you're working for a little change. You're not going to, change the world, in a year or two. You're gonna make little changes that will make things better, and keep working at it, and try and not get discouraged. It's a long road.
So consistency.
Yeah.
So you've served on the Federal Disaster Medical Assistance Team as well. Is there a specific moment or mission that stayed with you?
Well, the first one for sure. Yeah, I was, I'd done a lot of this global health work, from small mission work to bigger stuff. And when Hurricane Katrina hit down in Louisiana, I was contacted by a couple of groups that were going down to try and help out. And they said, will you come? And I said, well, yeah, I'm kind of good at working in a place where the resources aren't so great anymore. And I said, sure, I'll go. But we were a typical kind of ragtag operation. We did a little good, but not much, and we weren't very well organized, and we weren't really plugged in, and we didn't have a lot of supplies. But I came across a DMAT operation, which had these big tents, and they had a little pharmacy and nurses and doctors and therapists, and it was just, I said, this is really the way to do this. When the infrastructure is gone, you're here to kind of help in the meantime. And that was a DMAT that had come in to help out after the hurricane. And I said, what are you guys? He said, we're a disaster medical assistance. We're a federal team, but every state has them. He said, there's one in Sacramento. And I thought, done. And I went and contacted them. And a lot of these things, it's just kind of keeping your eyes open and saying, okay, there's an opportunity. And I got involved with them, and it's been fantastic. I mean, it's a great group of people. The program is really good. You do a lot of good, and it's done very well. It just requires some effort. It requires training, and we have every other month a Saturday you have to go for training, so it takes some time. But that's what got me. And my first deployment was the earthquake in Haiti, which was one of the biggest disasters in history, and that was incredibly intense. I mean, really, really intense. But we did do a lot of good. And so that was, for sure my most memorable one. And talking to people who had, had loved ones killed in the earthquake, or had nowhere to live and didn't have any food. And it was very, very impactful on me. And being able to help was really impactful for them. But yeah, that was kind of trial by fire. And I was the only pediatrician. So Haiti is a very young country, so there were a lot of kids coming in. So every time a kid came in, that was my job. So I didn't get much sleep for 2 weeks.
Wow. So you're also founding director of the UC Haiti initiative. Could you tell us more about that?
Well, that came as a result of my being deployed as a DMAT, worker after the hurricane. And typically a DMAT deployment is about 2 weeks, because you're just working solid, and you really can't be effective after 2 weeks. You're just really, you need a break. And so another team usually comes in. So after 2 weeks I left, and I thought, I can't, after this experience, just say, good luck, Haiti, I hope it works out for you. So I decided there's got to be things that we can do in the recovery phase and the redevelopment phase. And I said, okay, I'm at University of California. We've got, 10, we're up to 12 now, the greatest universities in the world with experts in everything. Maybe we can pool those resources and help them in their redevelopment. And so that's what got started as that initiative. And we did that for a while and did a lot of good, but eventually I kind of pulled back and focused more on the pediatric side of things, and so developed a pediatric training program at their state hospital, which was going very successfully until the last couple of years, when Haiti has really kind of fallen apart, sadly. So our program, we haven't been able to get back in 2 years, and we're right at the stage of saying it may be time to pull the plug, because it doesn't look like we're going to be able to get back. Very, very, really sad, dismal situation in that country right now. But that's kind of what led to that. So it was really as a result of that first experience, and then just realizing you can't just turn your back. I mean, it was impossible for me. And there are a lot of really dedicated, smart people at the University of California who were willing to help.
Yeah, that's amazing. It just seems like you notice and pay attention, and you take the initiative to do it. I think that's actually really
and I think
impressive.
if you do that, you find there's lots of other people that are willing to step in and help.
So you're a professor, clinician, global health leader, father of 5, and you and your wife have fostered over 150 children. I'm sure you get asked this a lot, but we're still fascinated. How do you manage to balance everything?
Well, my wife does a lot of it. I mean, the foster side of it, that was her passion. And of course, we did it as a family. But, and yes, I do a lot of different things, but I don't do them all the time. So, I do River. Well, it was a lot of work getting it started. But once it got going, now I'm there, maybe once a month. And in some of the other things I would do, I wasn't doing them all the time. And when I would practice pediatrics, one of the reasons I got the joint appointment that I did is I found that I didn't like the conflict between having a really serious teaching position and practicing and seeing patients at the same time. They were in conflict often. And so I worked out my schedule so that when I'm doing heavy teaching, I'm really not doing much patient care. And then when the teaching ends, I go back to doing more and more patient care. And so it's not like I'm, spending 40 hours a week teaching and 40 hours a week doing patient care and 40 hours a week, it's, you balance things out and you make priorities. I mean, you always make priorities. So for me, early in my career, my priorities were always my family. And so sometimes I would have an opportunity to do something, and I always think, well, how is this going to impact my family? And I'm very efficient too. I don't like to waste a lot of time. When I come to work, I'm here to work. I'm not the one that's going, I like my office is down here in the basement. Like, nobody bothers me. If I want to socialize, I can go up to the 3rd floor and chat with people, but I don't do that much, So I think, being efficient in what you do is good. And then also having boundaries and being able to delegate. You don't have to do every single thing yourself. I think that's been a struggle for me, because I always feel like, okay, my way is the best way, and we got to do it that way because that's the best way. And then I realize, okay, somebody else can do it, and it's not necessarily that it isn't the best. It's just different than my idea, and maybe we got to let them do that. And I think sometimes that can help you survive. But I like to be busy too.
Yes. It's kind of blocking out your priorities throughout the year.
Yeah, but I do lots of fun things too. I mean, I've always been a very active tennis player and athlete, and I still find time for that. So, I think you have to. If you're in a field that can be intense, you need to find a thing that gives you joy outside of it and maintain that. And I tell our students that all the time. In fact, I just met with all our brand new medical students last night at a reception. And I said, what advice do you have? And that's one of the advice I give them. Don't give up the thing you really love just because you're starting medical school. Find time to do it. You may not have as much time, and you may not have time for 2 or 3 things, but if there's something you're really passionate about, stick with it.
Yeah. Everyone's telling me, like, you have to have a hobby. In order to survive medical school, you need to have hobbies outside of medicine.
Yeah, what's your hobby?
I like to say weightlifting. I like to go to the gym.
Wow, yeah, the gym, yeah.
I also love teaching, but that's not all the time.
No.
So.
But and I find a lot of my colleagues who are in medicine are a little bit jealous because I have this nice cycle. I see patients for a while, and then at some point I think, okay, it'd be kind of fun to do something, and then all of a sudden I start teaching. And then at the end of the course, it's like, okay, this was great fun, but I'm ready to get back to see, and I cycle back and forth. And it's a really good way to go through things. I never understand. I know there's burnout in medicine, but I have never experienced it. And maybe that's why, because I get a shift. So.
Yeah, you get the best of both worlds doing it like that. So with all that you've done, teaching, practicing, serving globally, what drives you? What's your purpose or why?
I think, it almost becomes a cliche when you try and answer that question. I guess doing the right thing. What's the right thing to do here? Not necessarily the easy thing, but what's the right thing? What's going to maybe make people's lives a little bit better? And I think that's why we're here, to try and do the right things by other people. And I think that that's a thing that can give you satisfaction, but I don't think we're here just to have a good life, to accumulate things and to be comfortable. Not that there's anything wrong with having nice things or being comfortable, but that's not the reason, in my opinion, that we're here. And so sometimes doing things that aren't necessarily as comfortable as you'd like, I think stepping out into that is worth doing. And usually the rewards of doing it are way more than what you ever think they would be. So.
Yeah, I like to ask that question because it's a deceptively simple question and one that all of the pre-meds and medical students, they have to answer and get stumped by. And
But like when you came in to this interview and you said, I started doing this because I want to get better at communicating. It probably was stepping out of your comfort zone, and yet, here you are doing this great thing that's, helping other people, but it's a little scary sometimes. So, but I think, and like I said, I think we're not here to just be comfortable all the time. So, if you keep your eyes open and you find something that piques your interest as well, maybe I could do that, then give it a try.
Personally, I've had people try to talk me out of going into medicine. For students who feel discouraged, whether they're still exploring medicine or already pursuing it, what advice would you have for them?
I would say they're very smart to question, because medicine is probably one of the few careers that is very hard to get out of. Very few people go through medical school, get into residency, and then drop out or start practicing medicine, say, this was a bad idea, I'm going to go do something else. It's very seductive, it's prestigious, you make money, you've put a huge amount of effort into getting in. So if you get in and you decide it's not right, not that many people get out. Now, I personally feel like life is too short. If you made a mistake and you're doing it and you're really not enjoying it, I feel like life is too short, look for something different. I mean, I see my career and all the different paths that I've taken. And I think, you have to always be thinking about that. But it's good to question it and to say, well, why am I doing this? Am I doing it so I can make lots of money? Well, go into business then. Medicine's not the way to make a lot of money. Am I doing it because it's prestigious? Well, yeah, it is, but if that's the only reason, you're not going to be very good at it. Make sure that it's something that you really love, because it's really hard work. And I find that hard work is great if you love it, but if you don't love it, then you're doing a lot of hard work for something you don't love. It's not a great idea. So I think really thinking about it seriously So I think about this a lot of times when I'm talking to people that are interested in medicine, and I see, thousands of them because of, students that take in anatomy. A lot of them are interested in medicine or other health fields. And, sometimes I wonder, okay, why? Why are you doing this? Because, you're smart and you like science. I mean, there's lots of things you can do besides just going and being a doctor. But I think for some people, it sort of becomes a default. If you're really good at it and you could become a doctor, well, then you should. And I don't think that's really true. So I think thinking about it, what it is about it that you really do love, and then spending a lot of time in a clinical setting. What is it like to spend your whole day doing that kind of thing, day after day? I mean, it's one thing to do it once and say, well, that was cool. I got to scrub in on a gallbladder surgery. It was really cool. What if that was your third gallbladder surgery that day, and tomorrow you were going to do 3 more, and 3 more the next day? Is it still going to be cool? For most people that are doing it, yeah, it still is, but maybe not for you. And so I think getting to that point where you realize, okay, yeah, this is really what I like, and talking to people. What is it that you like? What is it that bothers you about it? So I would say if somebody that's considering it, for me, it's a great career, and I love it, but it's not for everybody. So spend a lot of time thinking about it. I guess that's really true for any career, but I think especially in medicine, because it's not so easy to get back out. It's too seductive.
Yeah, that's great advice. Well, as this interview comes to a close, I have one last question for you. If you could go back in time, what's something you would tell your younger self, either personally or professionally?
Well, people often ask me, it took me a long time before I went to medical school. Would you tell yourself, well, just do it back then? No, I wasn't ready for that then. I think what I did was the right thing. I guess I would tell myself to enjoy school more. It wasn't until I got into grad school that I really started enjoying learning. And part of that was because I finally felt like I was learning something that I could see the path and the goal. But really that was true in college too. I just didn't take advantage of it. And so for the first couple of years, I was pretty, mediocre would be an exaggeration, a pretty bad student. And I just really didn't care. And eventually I kind of learned that, wow, if you go to class and if you do a little studying, you learn some pretty cool stuff. And I love learning now. But for whatever reason then, I didn't. And so I think I wasted a few years. And I also wasted some resources. My parents were not wealthy. And thinking back on it, they sacrificed to send me to college, and I kind of frittered away some of that time. So I probably would tell myself, geez, try and learn some stuff. It's pretty cool. But you're young and dumb.
I like to blame it on my undeveloped prefrontal cortex.
Yeah, exactly.
Well, Dr. Gross, thank you for sharing your knowledge, stories, and wisdom with us today. Your commitment to teaching, service, and global health has impacted generations of future healthcare providers and just people around the world. I want to say on the behalf of all of your anatomy students, LAs, and TAs, a big thank you. You are an inspiration to us all, and I hope to live a life of purpose just as you have.
Well, thank you. It's great to be here.
Yay.
Well, good job. Good job.
Remember to like and subscribe if you want more content like this, and let us know your thoughts in the comments below about what questions you want answered about the field of medicine.